I'm Eliza, the Technical Supervisor for the In-Field Technical Support Team here at IDEX. In this video, I'm going to share some tips and tricks for sample collection and preparation for haematology. IDEX advises the use of a 21 gauge needle or at minimum a 23 gauge needle. Smaller needles may cause hemolysis and stimulate platelet activation. It is recommended to use good quality syringes and needles as poor quality materials may lyse cells. Shave the collection site and or clean with isopropyl alcohol, allowing it to dry for around 30 seconds before venipuncture. Excessive flexing of the paw may cause hemolysis. Apply the tourniquet at appropriate distance from the collection site and for no longer than 1 minute to prevent hemoconcentration. The selection of the vein depends on the veterinarian's preference, but we encourage the use of veins with a larger diameter. Options include the jugular, cephalic and saphenous veins. Once the site has been determined, insert the needle with the bevel facing upwards. The use of catheters or open drip techniques to obtain a blood sample may affect the quality. It is also strongly advised not to bend the needle, as this may cause hemolysis and platelet activation. When using a syringe and needle, allow the tube vacuum to aspirate the sample. If the blood does not initially flow into the tube, lightly depress the syringe plunger to start the sample flowing. Applying too much pressure to the syringe plunger may cause hemolysis, however. Gently transferring the sample to the tube after removing the needle and tube cap is also an option. However, be sure to insert a needle through the stopper to allow air pressure to equilibrate before placing it into the instrument. Vacutainer and microtubes will provide similar results, as long as the recommended manufacturer fill volumes are followed. If EDTA tubes are underfilled, the cells will shrink. When the tubes are overfilled, the sample will clot. After transferring the sample, gently invert the tube for 30 seconds to mix the sample with the EDTA. Mixing too vigorously will cause hemolysis. It is important to inspect the tube for clots to ensure sample quality and prevent damage to the analyzer. Manually invert the sample 10 times to resuspend the cells. When the sample is not homogenized, several parameters are affected.